My name is Abdul Alkin. I'm a consultant who works at Salford Royal NHS Foundation Trust. I work in pain medicine and in anesthesia. I mainly work in the field of chronic pain conditions. So a spinal cord stimulator essentially sends an electrical impulse to the normal spinal cord to stop some of those ectopic or hyperactive electrical signals from reaching the brain. The initial trial phase procedure is done as a day case procedure, takes 30 minutes, and you can be home on the same day. And then the final permanent implant is also done under local anesthetic, importantly. So it's a non-aerosol generating procedure. The patient is normally lying on their stomach, so there's no real risk of transmission via the respiratory route. And you go home again on the same day. The devices can be programmed remotely, so they're Bluetooth enabled. Patients are given their own programmer that they can use at home, and via video link, which is what we've done now in terms of education and looking at wounds. With the pandemic, what we've realized is we need to move to a cold site. So we need to split the work between, very mobile, efficient cold sites where we can do day case procedures with a rapid throughput, with minimal disruption to the patient and minimal exposure to patients who have, active coronavirus infections, or when you're in an environment where people with potential infections are coming into the hospital. And in that way, we'd still be able to operate even if there was a second wave, or the hospital services were moved more to treating coronavirus. We could still continue to provide pain relief to individuals and provide these day case procedures, which, it's not life-threatening, but neuropathic pain has been shown to produce a significant negative impact on health-related quality of life. And if you add to that the anxiety and stress of being, under lockdown, then you can imagine how that could affect families and communities and the ability of somebody to function. Chronic pain affects 1 in 7 people in the UK, so it is a common condition. We see people coming in with a pain severity score of 8 out of 10, that reduces to 2 out of 10. So from severe pain to mild pain. We have some patients, approximately 70% of our patients come off all of their medications. About 70% of patients have an improved pattern of sleep. We have people returning to work. So spinal cord stimulation, it does have a significant impact, both from an economic point of view and to the individual patient in terms of improving function.